What would it be like if I just weren't around anymore?
On a scale of 1 to 10, 1 being the best you've ever felt in your life, and 10 being the worst you've ever felt in your life, where would you put yourself right now?
Today, I feel about 11 today.
Depression is one of the most common psychiatric diagnoses. It is also a significant public health problem. By some estimates, 5% of the general population, that's well over 10 million Americans, suffers from major depression each year. It has also been estimated that up to 8% of all hospital outpatients suffer from depression, an indication that this is a relatively common comorbid condition. The use of several new antidepressant medications in conjunction with other interventions has revolutionized the care of this condition and brought new hope to many of those who suffer from serious depression. This program will introduce the condition known as depression and will give an overview of the current medications and nursing interventions for treating it. We will begin with a discussion of the signs and symptoms you may encounter as you seek to assess the condition, an overview of what we understand of the pathology of the condition, an overview of the types of assessment tools and nursing interventions used to treat depression, a detailed look at the major medications in use, an examination of the process of nursing intervention with medications, and then an examination of the specific side effects you might encounter. First, we will discuss assessing the signs and symptoms of depression. Depression is not simply the down-in-the-dumps feeling that we all experience from time to time. A person who suffers from depression experiences major changes in his ability to function on a day-to-day basis. There may be signs of psychomotor agitation or retardation, feelings of worthlessness, difficulty in thinking and concentrating, and diminished interest or pleasure in activities. He may also experience disturbances in sleep, mood, eating patterns, body weight, sexual desires, grooming habits, energy levels, and socialization. In severe cases, the individual may have recurrent thoughts of death, dying, or suicide, and may develop more serious psychotic behavior. These are obviously not just the daily mood changes we all experience, but signs of a more serious disorder. Now we will briefly discuss what we currently understand about the pathology of depression. The etiology of major depressive disorder is very complex, and despite the progress that has been made in recent years, it is still not very well understood. Patients with major depression have symptoms that reflect changes in brain chemistry, affecting norepinephrine, serotonin, and dopamine neurotransmitters. Based on our understanding of these neurotransmitters, various hypotheses have been developed that attempt to describe the pathophysiology of depression. Based on these hypotheses, antidepressants have been designed to heighten the level of a target neurotransmitter at the neuronal synapse. This is accomplished by one or more of the following therapeutic actions: boosting the neurotransmitter synthesis, blocking its degradation, preventing its reuptake from the synapse into the presynaptic neuron, or mimicking its binding to postsynaptic receptors. Explaining how any one drug alleviates depression probably entails multiple direct and indirect therapeutic actions involving one or more neurotransmitters.